As you look at these 4 differences and think about why the preborn are smaller, why a toddler is less developed, why the preborn are more dependent, why a 5-year-old may be in a different environment than someone who's traveling the world and backpacking through Europe, the answer for that is age. The preborn are smaller because they're younger. They can't think yet because they're younger. They're in their mother's bodies because with our particular species, at that stage of our development, when you're that age, you require to be in the uterus of your mother for your survival. Why can a toddler not think and reason like we can? Because of their age. Ultimately, all the differences come down to how old you are. And if it is wrong for someone who is whiter to take the life of someone who is darker, why is it okay for someone who is older to take the life of someone who is younger? You cannot control your skin color. You cannot control your ethnicity. And you cannot control your age. And it is wrong to discriminate against someone because of their age. That makes the case for the humanity and therefore personhood of the preborn. That personhood should be defined by being human, not by any of these criteria, because then some humans get left out. Now I'd like to answer the question, is abortion killing? Is it an act of violence which is killing? It is controversial to call abortion killing of an equal to us, killing someone of value, because in some way we've all been affected by it. Our mothers may have had abortions. Our sisters may have had abortions. Our aunts, our cousins, our friends, our patients. We may have had abortions. We may have counseled a friend to have an abortion, counseled a patient to have an abortion. We may have done abortions. And it is controversial to call abortion killing because of what it means we've been complicit with. And I want to make the point that in condemning the action of abortion, I am not condemning the actors who have been involved with abortion. It is entirely reasonable to judge a behavior and not judge a person. To condemn a behavior and refuse involvement with the behavior and not condemn the person who has done it. The question is it that we don't know abortion is wrong, or we don't want to know? Is it that we don't know it's wrong or we don't want to know? Because if it is wrong and it does kill and we've been involved with it or those we love have, then it's going to hurt to realize what great injustice we or others have done. But you of all people know pain serves a purpose. Pain motivates someone to go to a doctor to get a painful lump in her breast removed. She didn't know it was there until she felt pain, and now we can hopefully eliminate the cancer. Pain causes us to identify things which are hurting us, or just cause us to stop doing self-destructive behavior. The little girl I mentioned, Gabby Gingras, who can't feel pain, as a baby, she bit her fingers until they bled and chewed her tongue like it was bubble gum. She poked her eyes so much an infection resulted in one of her eyes had to be removed. There's a tragedy and a problem when we don't feel pain. Pain stops us from doing self-destructive things. And if we don't face up to what abortion is because it hurts too much to face up to what it is, we're going to do self-destructive things, or we're going to do other destructive things and continue to be involved in that which kills. And does it kill? Well, using imagery from Nucleus Medical Art, which has all kinds of medical procedures drawn out on its website, we see clearly with this dilation and evacuation at 23 weeks, it undoubtedly is killing. It undoubtedly is pulling apart the body of a human being, piece by piece. It is dismembering, it is decapitating, and it is disemboweling a member of the human family. Even early in pregnancy, a suction and curettage abortion, 9 weeks, we see that child growing in the environment she should be in. Nowhere else should she be. And the power of that suction to literally ripping her hands and feet apart. We could have the volume, I hope the technical guy is still here, volume turned down, thank you. I'm going to play some imagery of abortion. I'd like to read for you as this is playing what an abortion supporter, Naomi Wolf, has said about people like me using abortion imagery. She says, the pro-choice movement often treats with contempt the pro-lifers' practice of holding up to our faces their disturbing graphics. But how can we charge that it is vile and repulsive for pro-lifers to brandish vile and repulsive images if the images are real? To insist that the truth is in poor taste is the very height of hypocrisy. Besides, she says, if these images are often the facts of the matter, and if we then claim that it is offensive for pro-choice women to be confronted by them, then we are making the judgment that women are too inherently weak to face a truth about which they have to make a grave decision. This view of women, she says, is unworthy of feminism. I would add another view that is unworthy of feminism is the idea that we women need to kill our children to deal with difficult life circumstances. Another view unworthy of feminism is that we women need to have the ability or the opportunity to kill our children to be considered equal with men. My colleague Greg Cunningham has said, there is a difference between blood shed to heal and blood shed to kill. What you are seeing and have seen is the shedding of blood to kill. And you have to ask yourself, as a physician, are you in the business of shedding blood to heal or shedding blood to kill? Finally, I'd like to talk about established bodies of authority, including medical bodies, for why you should have no involvement with what you've just seen. CMA Code of Ethics, the UN Declaration of Human Rights, the UN Declaration of the Rights of the Child, Canadian Charter, the World Medical Association's Code of Medical Ethics, and Declaration of Geneva. With regards to the CMA Code of Ethics, point 9 on fundamental responsibilities is that physicians have to refuse to participate in or support practices which violate basic human rights. Now, you can say you as a physician won't refer for abortion because your conscience tells you you can't, because your religion tells you you can't, because your personal views tell you you can't. Fine, if you want to say that, fine. But I would say as a physician, you should all say you can't refer or participate in abortion because the CMA has a code of ethics where point 9 says you cannot support practices that violate basic human rights. And as long as my case stands for the humanity of the preborn, they have the right to life and you can't be involved with that. Even point 35 of the CMA code of ethics says that where a patient indicates they will harm someone else, then there is that need to disclose that information. So the question is, are the preborn someone else that even the suggestion of abortion about them and towards them could be talking about harming someone else? The Declaration of Human Rights I've already gone through. The rights of the child, the UN says, the child by reason of his physical and mental immaturity needs special safeguards and care, including appropriate legal protection before as well as after birth. The Charter says everyone has the right to life, liberty, and security of the person. It also says that every individual is equal under the law, has the right to equal protection without discrimination based on age. So abortion violates that because it's age discrimination. The WMA says very explicitly that a physician shall always bear in mind the obligation to respect life. And finally, in the WMA's Declaration of Geneva, it says, I will maintain the utmost respect for human life. The evidence I've provided is that the preborn are human beings. They are human lives. The evidence I've provided is that abortion is an action which destroys those lives. So it violates these established and well-accepted codes of medical ethics. Quick question, my time. I'd like to close by leaving you with this quote by Robert J. Lifton, who authored the book, The Nazi Doctors and the Psychology of Genocide. He said, psychologically speaking, nothing is darker or more menacing or harder to accept than the participation of physicians in mass murder. However technicized or commercial the modern physician may have become, he or she is still supposed to be a healer and one responsible to the tradition of healing which all cultures revere and depend upon. I am not asking you to change what it means to be a physician when I ask you to not refer or commit abortions. I am asking you to live up to what it already means to be a physician. Someone who looks at human life with great awe and wonder and works to respect and protect that life, to truly be a healer. Thank you.